Everyone, my phone just suddenly shut off. I don't know what happened. So hi, Dr. Jason, I just added you. Hi,
Oh,
how are you? Good
I'm
morning.
doing great. Good morning. Just had a surgery, my aunt, so it worked out
Nice.
perfectly.
I'm so sorry. My
How
phone just suddenly shut off and I was like, what the hell happened? But it's okay.
I'm my internet, so I'm glad it was your phone and not my internet.
Hope you're well. Hope everything's fine. I've been following you for quite some time. And
I heard
honestly,
fantastic. I appreciate it.
and you have a big fan base in Saudi because honestly, like, I always interview doctors because I really enjoy using this platform as an informative platform for most of my followers because I love skin, by the way. And I think in another life I would have been a dermatologist myself.
Oh my God, I love that. Well, we'll make you the ambassador for Saudi for my skincare line when we are relaunched to the UAE and in Middle East will be at the beginning of the year.
Oh, that's amazing.
Yeah,
So
I'm actually
honestly,
got
um,
credentialed Dubai and Abu Dhabi.
you have to come to Saudi first.
Yeah,
But
trust me, I want to.
yeah, we're the biggest market, by the way. And honestly, like, the Arab woman is very into skincare. And I'm sure you see a lot of them in Los Angeles in the
Fair.
summer. So you're quite famous and very known. So today I really wanted to have you on my
I
live. And
do know I'm a little pink. I'm peeling if you
I'm
can't
feeling,
see. So I'm always doing some laser or some new combination. So that's why I'm excited to have you ask some questions about that because we're constantly doing everything and testing out new things for my skincare line constantly.
let's start first by talking about how did you decide that you want to be a dermatologist? That's the first question. A
Well,
doctor.
originally be a plastic surgeon and I did a lot of rotations and I just didn't really love the surgical aspect. It didn't give you those patients for long term. Like you would do a treatment and then you may not see them again. And I really wanted to do something. Now at the time, this is 15, 16 years ago, aesthetics wasn't as big. And I was really, looking at something that, you could do procedures. So I went into dermatology. And I didn't know how much dermatology was going to be impacted with aesthetics. I knew some dermatologists did skin cancer surgery, some did liposuction at that time. I'm of the time that we learned how to do all those things. I was even doing facelifts, eye
Oh,
surgeries. Oh, yeah, I was, skin cancer removal, and then we would move the face to cover the scars. We would do big surgeries and liposuction with fat grafting. So I got a lot of experience as a derm, and I didn't realize how much as a dermatologist it would lead into being able to aesthetics. So that's why when you see a lot of what I do, which is not just skin, we're doing body surgery, we're
I
doing
saw.
trans procedures. That's because I have a lot of sort of procedural aesthetic background in fellowships and in plastic surgery. So I'm like kind of the last of the derms that do those aggressive plastic surgical and cosmetic surgical procedures. But that's how I went into doing skin. And then it led to me actually doing more plastics.
And you actually did your fellowship in skin cancer surgery and
Yeah,
lipo and
first
plastics, right?
Mohs surgery, where we remove microscopically small areas of skin cancer and then we reconstruct it. At that time, people would be left with scars and they would tell you just wait months for those scars to heal. We really didn't even have a lot of really good skincare then. It was all
Yeah, true.
Petroleum or Crisco. I mean, it was really just fat is what people were putting on there. And I started lasering them early, like when the stitches would come out, just like a tummy tuck or a breast now surgery. We do 3 weeks later, we start lasers. And the laser treatments, if done early enough, really help those scars. And then that led into, hi, Dr. Mike. And then that led into doing skincare products like peptides and growth
True.
factors and hyaluronic acid and silicone to be able to like in retinol to really help remodel these scars earlier. And we discovered so much earlier on that scar treatment needs to be done right away. And
Yeah,
so
not
that's
true.
to
You're
do
right.
the skin cancer and lasers, and that led to me doing big resurfacing treatments and working with companies to develop new lasers, working with skincare companies, develop new products. And so that's why I decided to start my own, which is Emerage Skin, emeragecosmetics.com. And the reason is I designed it so that you could heal after procedures more quickly. And actually the Aerify mask, which we apply every Wednesday and Sunday night on a live, I would love to get it to you and have you do it with me alive.
I would.
That mask is designed for dark skin. Well, it's really every skin, but it's for sensitive skin types and darker skin. It was a combination of ingredients that calm inflammation, but also treat things as maintenance. You could put it on after a facial, you could put it on after laser, you could do it after microneedling, and you could do it just at home as a boost. And other areas like the groin area, the neck, the armpits, where women get a lot of pigmentation, especially my Middle Eastern friends.
Big time.
My best friends.
It's nonstop, by the way.
Oh my God, I know. My best friend's Indian, and that's how we really started learning, because 15 years ago, we only had lasers. And she would get hyperpigmentation every time we would laser, and then we had to use products to calm it down.
And
so
even
now,
peeling, by the way, like, you know, in our part, like I've gone to some, like I'm pregnant, by the way, and usually when I'm pregnant, after pregnancy, I always get a lot of discoloration, and then you'd go to a clinic and they tell you should do peeling. Then you do peeling, and then it gets worse.
I know. Well, that's the problem is, so most people who aren't really well trained in peels, they do inflammatory peels for pigmentation. It looks good at first, but then the rebound effect is worse. Those are like TCA peels where you kind of go off in sheets. What you really need when it comes to like pregnancy and pigmentation is mask peels that don't burn the skin. They just turn it over slowly, like a Cosmetic or my Aerify mask. I'm actually in production now, so that next quarter to the Middle East, we're going to do a real in-office lightning mask that would compete with everything else out there, because it will treat all of those issues you're describing. And there's only a few lasers that are really good for it too. I don't know if you guys have them, but there's one called Aerolase. That's a microsecond YAG laser, or that actually will treat pigment, and people even do it when they're pregnant sometimes, because it reduces the melasma. And that's, I know it's a you know, well-taught thing that you shouldn't do treatment when you have pregnancy.
True.
But lasers, they penetrate, and we've been doing them for a long time for women that are pregnant or are on hormonal medications or steroid pills, and it causes them to get hyperpigmentation. Hey guys, hey Tommy. And they, you know, that helps. So that's one thing. There's another laser called Clear and Brilliant. That's a lighter laser that can be done, as well as a newer one called Cyton Moxie. And all of those can be used on darker skin. They can be used for the pigment. You can combine it with the right type of peels and skincare products to control the pigmentation. That's actually one of my biggest expertise, is pigmentation. And most of the time it's in my, you know, ethnic, mixed ethnicities, darker skin, olive tones. That's always influenced by hormones and sun. And you're in heat. You're in the heat all the time. And that, exactly. So that's also stimulating the pigmentation. I have patients where they'll clear up and then they go in a sauna and the pigmentation comes back, because that's proof that the heat also affects it. So it's much more difficult by you to really control that pigmentation. And you need then the right protocols for products, the right lasers, if there are any. And obviously, like I said, we're in production of those now. And then also some newer, there's actually a newer device called, a company called Roar Aesthetics. They're not in Europe or in anywhere outside the United States yet, but they will. And they have a Pico laser that's really good as well for pigmentation.
The Pico laser is available in our part of the world, but a lot of the other lasers you talked about are still not here.
Newer version. You know, the Pico Focus is good and it can help, you know, but this is like a newer, more updated one that works a little bit better. So for patients that body areas and things like that too can be treated.
I saw one of your interviews, and you said that one thing you really liked and that was of interest to you is that you like to have a long-term relationship with your patients.
Yeah, and that's, I'm sorry to cut you off. I was trying to take the first question, but plastics, you didn't really get that. I mean, person does a surgery and then they, you know, they may or may not come back in years to come. When my practice, the reason I loved doing skin and aesthetics and taking care of people like long-term to prevent their prejuvenation and prevent the aging process, you're seeing them consistently. You're getting to know them. You're understanding their skin. It's just like your hairstylist or your dentist. You know, you really feel comfortable with them because you're going to them so frequently. And I'll never forget, one of the first patients I ever had was in her 90s, and she had terrible psoriasis, and I was treating her as a dermatologist, and she said to me, you know, my husband died and I want to start dating again. Do you know how to do a chemical peel? And she
Yeah.
was there for psoriasis, but she was asking me about a chemical peel. She was in her 90s and wanted to date. So we did a really strong peel. It made her wrinkles all disappear. And she said, and she started dating somebody 10 years younger than her and said she had her boy toy. I mean, that was one of the biggest, most successful learning experiences I ever had. Because one, obviously, it doesn't matter what your age is. You want to feel good, you know, with a
True.
significant other. The other was she cared about how she looked, even at 90. You know, and it was really important to her to get back in the dating scene, even though I was seeing her for psoriasis. So I realized at that point that how somebody feels about themselves and how they look at themselves makes such a difference. And that's why I really wanted to go into that long term, because I knew that I could be a part of that for people, you know?
But it's nice to see and watch that change and that happiness and that smile out of your room,
Yeah.
and looking at how like she sees herself before and after, and that confidence that comes to a woman. To me, this is really important. And it's so nice to see as a doctor, of course, that you created that change, right?
Yeah, I mean, it feels really good. And remember, that's at the time when we didn't do a lot of things. Like, we didn't have a lot of treatments for severe pigmentation and acne scars and burns and things that I'm treating now. Even when you treat those, it's like life changing for people because they feel so much better about themselves. They're a better person, better in their relationships, better at work. They accomplish so much more. And so, yeah, I mean, that was my learning experience years ago. Now I have patients 15 years still seeing me, and they look even better. I always tell them they're like a fine wine. You know, they're just
Get
better.
better by age.
Yeah, because we're doing all these new treatments that didn't exist years ago to keep everything from falling, from keeping it from developing a skin cancer, keeping it from developing the wrinkles and the pigmentation.
You said in one of your interviews, you said that you basically like to cater to every client and create a program that fits every client individually. And you also said that in one of your interviews that because you're one of the number one practices in the States, that actually the machines that do the lasers and all this actually come to you for trials. So you get these
Yes.
machines faster than everyone else, and you can actually use them on your patients. So tell us more about that aspect, and how did that happen?
Well, when I first started, you know, there wasn't a lot of lasers. There wasn't a lot of research in aesthetics. And I started doing a lot for HIV patients that had facial wasting. So we were doing fillers to kind of learn about new fillers and how it affected the face. But then we also started doing a lot with scars, and new lasers were coming out. And since then, I've always worked with companies to develop new technologies. Our focus now is long-term prejuvenation, you know, collagen production, pigment reducing, wrinkle reducing, and doing it with minimal downtime. So every company, when something new comes out or they have in development, we're getting the robotic version of that laser, and we're testing it out, and we're doing different versions of the hand pieces and different, you know, levels of the energies to test and see, you know, who it's safe on and what it's good for. And we're doing that I like doing that because it's cutting edge, and it helps with the development and progression of the field, because you're never going to progress if you don't try new things. And, you know, that's how it started initially, is the studies. Now we're doing it with regards to actual treatments. And so rather than doing just the research, like, you know, somebody like you're saying pregnant or has acne scars or they have a burn, we're really testing new devices to treat those things so that we can get that out to the community much more quickly. And we're doing it also with skincare. That's the biggest thing. Like, I just kind of marketed and promoted two different treatments I have, one called Titan Bright and another called Hollywood Spotlight. And both of them incorporate multiple lasers, combination treatments that are going to improve tightening and texture and long term, but along with skincare with my Emerage skin.
Yeah.
And so that's what you do in real practice. You know, you're combining modalities, you're using products that are going to be the at-home treatment plan. And so I like to develop these protocols for people where they come to me every month to 3 months for specific treatments, like a monthly facial and maybe a microneedling, or every 2 or 3 months a laser, something that's a little bit bigger, or a deeper peel. But in between that time period, they're doing at-home derma rolling. They're doing their skincare. And if they have a specific issue, like you said, we have a treatment plan that's customized to that issue, like the acne scarring, or let's say it's pigmentation from hormonal pigmentation, or it's tightening and wrinkles. So we develop that plan. But in general, I always tell people, really, every 3 to 4 months, you should be doing some sort of bigger laser appeal. And every month, you really should be doing a facial with some sort of microneedling or some sort of collagen producing treatment. And then in between that, it's up to you. Is it, I want to go get a facial twice a month, and then, or do I want to do peels, more in between? How aggressive do you want to be on skincare? Look, like I said, I'm literally peeling every probably 2-3 weeks. I'm a little bright red right now, but it's not too bad because I'm doing, I did.
Good. You have
Yeah,
great
but it
skin,
looks
by
good.
the way.
What'd you say?
You have great skin.
Only I have her right here, and we're going to do plasma pen on this soon. So yeah, thank you. I've been doing laser skincare since I was 27.
It's amazing skin,
40.
mashallah. I know you have to leave soon, but I want to ask you about some of the procedures you do.
Yeah.
You do this thing as well called QWAO for the cellulite, because in our part of the world there's a lot of, like, it's the food. So, and you do Selfina as well. What do you recommend more? Which one do you prefer, or it depends on the client?
Well, here's again about that progression. The client, a lot of it depends. A lot of people actually aren't candidates for cellulite treatment. They actually need skin lifting or skin tightening. That's the problem. Most of the time, as you sag, let's say you go up and down in pregnancy and or from having kids, and you lose or gain weight and your skin sags, you see the cellulite more. So the issue is, inject fillers into there. Yes, you could use Selfina and break it apart. That's a motorized needle to kind of lift it and break it apart, or the QO or QWO to kind of damage the collagen there and rebuild new collagen. The problem is, if you need skin tightening, it's really only going to improve a little bit. So most people that are great candidates for that are younger and have very little cellulite. They don't have a lot, especially
So
not
not
on
someone in 40s, late 30s. You recommend someone younger with very mild.
At like say 30s, 40s, 50s, where you really need lifting. We actually created a thigh lift that hides the scars in the groin and under the buttock, and that gets rid of. Yeah, it's called a spiral lift, and it's honestly, it's a lot of women need it more than they think, and that really gets rid of like 90% of the cellulite. Obviously, if on the buttock there's big dimples, QO could do great. And what I like to do, if you could do the Selfina and you're in a candidate, you should do that first. And then 3 months later, you start the QO. That's usually what I tell people. So that's where the progression comes in. We're now combining things to get a better result. When I first started with Selfina, we just did Selfina alone. Then a year later, when we found out by injecting Sculptra or certain fillers to the, like yesterday I did a live of dilute radius injected into a hip dip. But that can be used. So we will often combine the Selfina with the filler and then start the QO. So we do it all together. There's a new
treatment,
have to be looking for those combinations. And there's a newer treatment out now called Pixelate. That's again by that company Aurora Sex I was telling you about. An older device that uses needles with heat called Morpheus was used good for tightening and improves texture. The Pixelate now is even stronger, and I find that people really like it on the buttock and the posterior thighs, even the knee area, elbows, to help those wrinkles and tightening. So you may want to look for microneedling radiofrequency treatments as well as part of that maintenance. It may not be the initial treatment. I know I do it on my face and neck for tightening, but it may be like after you do a surgery or after you do some lasers or the Selfina, you then start the Pixelate or the Morpheus treatments for the long-term plan.
Question: the thigh lift is a very invasive surgery, of course, right? The thigh tightening, is it invasive?
It's considered invasive because it's a procedure, but it's actually not bad. It's really just a week to 10 days of downtime, and most of the clients have, when they do it, they tell me they can't even believe how easy it was. So, you know, a full thigh lift's a different story. That's a big scar. But this modified one where it's just improving like the lower buttock, the posterior thigh, and the inner thigh, the spiral is a lot less. And a lot of patients, they do it and they love it.
So it's not. So it's not so like it's not like a mommy makeover and the tummy
No,
tuck.
it's much
Oh.
less than that.
And another thing I saw that we don't have in our part of the world is that you actually tattoo the stretch marks. I don't know how you do it. Like there's something that you do with the stretch mark that actually that was like to me something I've never seen before.
Yeah, there's two different ways to do that. There's inkless and then there's ink. So in some people, you actually put a camouflage, a coloring. It just depends on their own skin tone and what they're looking for. In some people, we use an invisible ink that penetrates the scar and develops collagen in it and camouflages it without really a color. We love this treatment because for years I've been doing lasers, and I know so many patients that I've seen from the Middle East come over here and get a cool laser, these other treatments that just don't work. They're not effective on most of the white or sort of irregular textured stretch marks. And I would tell you if the scars work. I do think at-home derma rolling and stamping actually helps the skin, and I have it on my website because I have a whole protocol for it at emeragecosmetics.com. But I truly think that the go-to treatment in the future for stretch marks is going to be this inkless medical tattooing, which we do in the office, and patients love it. Like, we have amazing results from it. It's 2-3 treatments, typically 2, to really see 50-60%, if not even more than that, improvement
Not a
without
lot
the
of
risk.
people have that, right? But not a lot of people do that, right?
No,
This treatment.
very few. I have a good friend that's one of the world's expert in it, and she works here. And you know, now she's starting to train more people, but it's going to be a while before a significant amount of people are trained.
Regarding 3 things you recommend, I know you have to go. I know. I think you have another
Okay.
surgery. 3 things you recommend someone. You're into skin. You're a dermatologist. Tell us three things you recommend for people to do to take care of their skin in general. So, I know you're in LA and you're far away. What are the products to use? What to avoid, and what to really do every day?
Well, here's one thing I would tell you. Even if you're far across and away from me, we do virtual skincare consultations. I actually have 4 estheticians and 2 skincare specialists. They do typically about 4 to 10 each a day, where they do a virtual consult with you over the phone. They go through over 400 different product options. They look at all your skin. They customize the skincare. And in my opinion, it's really hard to say what should you do because it's so customized. And even myself, I use 10, 15 products. But you should definitely have a vitamin C. You should definitely have some sort of retinol, some sort of non-hydroquinone lightening agent, and a stem cell and a growth factor product. Those are the things I always say for anti-aging, pigmentation, and collagen. That's the
And
initial.
you have them in your brand. Your brand. You
I,
have. You
yes,
have
in
this.
my brand, Mirage Skin, we have a great vitamin C, which I actually made for darker skin tones so they don't get sensitive, called Aoxy. We have a hyaluronic acid that's really hydrating. I love it after procedures. My patients like literally drink it after procedures, but we use it every day. And I always tell people to mix it with a really good growth factor or peptide serum. So in my product line, there's something called Refit Face. It was designed for lasers, but we work very closely with a company called Antiage, and I know you guys have it there.
Yeah,
Antiage
we do.
was human marrow stem cells, amazing product line. The brightener, the accelerator, and the serum all are really good for darker skin tones, and you can combine it with my line to get an even better result. I really believe in at-home derma rolling. I think that if it's done well, and I have a blog, I can send it to you. Can you post it?
Please do.
It's
Yeah.
it's really detailed videos on how to do it, what products to use with it. You could use the stem cell ampules at the same time or the hyaluronic acid. And then the great thing with the derma rolling, you're creating these little channels in the skin. And yes, that's going to give you collagen production. But if you have pigmentation, you can use products immediately that will help the pigmentation more. So especially if you're pregnant and you have like, you know, pigmentation, you could be using that and putting on more vitamin C, putting on a non-hydroquinone lightening cream, putting on a stem cell to get it so that you don't, or even tranexamic acid, which is in the anti-age brightener, so that you don't get that pigmentation, you know?
Um,
Um, And so then the other is, like I said, every 3-4 months, a deeper peel or laser. And it just depends on your skin tone. If it's a lighter laser because you're darker skin, then you definitely want to do like the Clear and Brilliant or the Moxie treatment more frequently. If you're a little bit lighter of a tone, you could do a stronger laser like a Halo or a Fraxel or something even a little bit more every 3 to 4 months for rejuvenation. And then the newest treatment that I love and can be done on dark skin is plasma pen. And I'm sure you've seen it before. It's the
Yeah.
little dots that you make around the eye. Now, here's the thing about it. You have to go to someone that knows how to do it because especially in darker tone, you can get little dots of darkness there. But if it's pre-treated correctly and it's post-treated correctly, you can get amazing tightening and it helps a lot with the dark circles.
Okay. Last question, I'm sorry. In our
That's,
part of the world, they really market Exilis, Ulthera, EM Sculpt, Sculptra, and HIFO. So I want your opinion on these machines. I know maybe they're outdated for you.
no. So there's different radio frequency devices out there. Exilis is a
And
monopolar.
Villa Shape, sorry. And Villa Shape is the last one.
That's probably a little outdated, but Exilis is radio frequency and ultrasound. It's a great device. M-Sculpt is obviously muscle toning. It's a great device. The issue with all of those is you have to do them consistently. Those are your personal trainers. So I always tell people, if you're going to do radio frequency and muscle toning, it needs to be a couple times a month. If you're not doing that, you're just not going to see a result from it. Obviously, you do a series of treatments first, and depending on the areas, you want butt lifting, you want thigh tightening, you want arm tightening, do them in those areas, but keep it consistent. Once you stop, it's like you're not working out anymore. It's going to go away.
It's technically like going to the gym.
Exactly. So if you're not going to be committed, don't do it. The other thing is with HIFU or Ultherapy, for example, those are going to be your clock stoppers. They're not going to be reversing. They're going to be slowing down. So you may not actually even see a result from those. Those may be tightening that are going to be that in 10 years from now, when you look at yourself compared to your friends, you're going to look better. So you have to be thinking of those as preventative. Those are not a treatment you're going to see a result. But I've been doing Ultherapy and Thermage, radio frequency, once or twice a year since I was 27. So it's good to do, but it's going to be preventative. You're not going to see as much of a change. That's why I feel like microneedling radio frequency should really be the treatment that you guys are going for to actually see something for tightening. You probably have over there Intensive or Morpheus.
Yes, we do. How do you like those?
Yeah, those are good. I like, honestly, this Pixelate that we're testing now is probably going to be the new gold standard, but all those other ones are really good. And that will give you more of a thing that you see because you're going to get a little bit immediate tightening, a little bit more collagen production. But still, you're going to want to do those other treatments. It's just those are going to be, you have to think of them in the right way. Those are your trainers. Those are your slowing down. Those are your constant treatments. You're not going to see as much from them immediately, but your legs will look better. Your buttock will look tighter while you're doing it, just like if you're exercising.
And are you coming to our part of the world anytime soon?
Well, here's what I was saying. I just got my credentialing for Dubai and Abu Dhabi. So I'm hoping to be out there sometime between December and January.
Okay, great. That's actually good news. But why December, January? Come later. It's the holidays.
Timing for me to at least start. People will still want treatment. We'll probably be coming 2 to 3 months.
Okay, that's amazing. That's great news. You know, Saudi's right next door, so it's easy to fly.
I know. So that would be my plan. So I'm hoping that works out. It would be great.
Let me know. I'd love to meet you in person. And just honestly,
in person, but I also want to send you my line. Did we send you my line?
No, not yet, but you can send it to me.
All right. So send me let's send it over and let's do an Aerify live where you apply the mask.
Sure, I don't mind. Let me just deliver. I deliver in 10 days. And then after that, we can do another live.
Perfect.
I can pop any minute. I can actually go to labor now.
Get the products anyway.
Yeah, great. Yeah, sure.
Well, I appreciate it. And I think, you know, just keep watching because I'm always going to be promoting new things. There's a new facial device that we've been talking about called Mirror Peel that I think is going to be huge by you guys in the next year or two. It's a micro channeling infuser. So it actually needles the skin while it shoots in products that are custom. We've been posting that. It's called Mirror Peel. We call it Transbrasion Facial. It's going to be amazing product. I think you could do it everywhere: chest, armpits, groin, everywhere. And then these combination therapies are really what's the best. It's just making sure you go to the right person and you use the right skincare.
I think I should come to LA. I think a lot of us Arabs come in the summer or come on holidays, but definitely I think I want to use your machines.
Fine. And the other times
I'm planning to come in April.
All right, that'll be great. So then when you're here, we'll do more stuff here too.
For sure, for sure. I'm actually I studied in Boston, by the way. I'm an East Coaster. I did my bachelor's and my master's in Boston. So
that's awesome.
the States has a very big place in my heart. Before COVID, I was there every year. Like I'm in New York at least 4 times a year, but I haven't been to the States in 3 years now, so I miss it.
You back, and then I need to start coming there.
But yeah, you have to, and I think Saudi now is the place to be during this time and this big change. So hopefully next time we can host you. And
yeah. Well, I appreciate it. Thank you so much for educating people. I think they're going to be just so knowledgeable and get all that information. I think it's really going to be helpful for them. And anything you need, let me know.
I will. Next time we do the live with the whole application process together.
Love it. Yeah, we'll get you the product. Just email me and I'll send you the blogs.
Sounds good.
All right.
Send me the vlog for the microneedling, the one you said I should post.
I'm going to send it all.
Thank you so much. Have
You're
a nice
welcome.
day and good luck.
Bye, guys.
Bye.